know that approximately 2% of all pregnancies are ectopic and only 1 out of 50 ectopic pregnancies tend to survive? Well, if you don't, then I am here to teach you all about ectopic pregnancy. Hello mga ka-student nurses! I am Jidal Licudini, your ka-student nurse from University of La Salle. Ectopic came from the Greek word ektopos, which means to be out of place. So to cut it short, ectopic pregnancy is defined to be the pregnancy outside the utero. It is also the second most common cause of bleeding in the first trimester of pregnancy. Ectopic pregnancy may occur in different locations besides the utero, but the most common part is the ampulla, in which 70% of ectopic pregnancy occurs. Now, let us move on to the causes of ectopic pregnancy. Some incidents causing ectopic pregnancy includes smoking. Epidemiological studies show that cigarette smoking is a major risk factor for tubal ectopic pregnancy, but the cause for this remains unclear. Next is the pelvic inflammatory disease. This is due to the tubal scarring. And lastly is the intrauterine devices, because it slows down the travel of the zygote. Now let us move to the signs and symptoms. If a person has ectopic pregnancy, she will experience unilateral lower abdominal pain, sudden and severe knife-like pain, and lastly is the spotting or bleeding. And the most common characteristic for this is the dark brown color. But these signs and symptoms are only for the unruptured tube. However, if the tube has ruptured, then the patient will experience signs of hemorrhage called the Collins sign. This is also known as the bluish discoloration in the umbilicus. The patient will also have hard and rigid abdomen, as well as the decreased blood pressure and increased pulse rate. Now, how will we manage this if this occurs? For an unruptured tube, a medical or surgical management can be implemented. For medical management, methotrexate can be administered to induce abortion, but this is only possible if the pregnancy is less than 3 centimeters and there's no fetal heart rate present. That is then followed by leucovorin to reduce the side effects of methotrexate. For surgical management, 2 procedures are possible. These are the salpingotomy or salpingostomy. This is the removal of the product of conception by creating a linear incision in the fallopian tube and then stitching it again afterwards. On the other hand, if the ectopic pregnancy is already ruptured, then there's no choice but to do a surgical management called the salpingectomy or the complete removal of the fallopian tube. Now, I think that is everything that you need to know about ectopic pregnancy. Let us recall our main points. Ectopic pregnancy is the pregnancy outside the utero. It is caused by smoking, pelvic inflammatory disease, and intrauterine devices. For an unruptured tube, signs and symptoms would include the unilateral lower abdominal pain, sudden and severe knife-like pain, and spotting or bleeding characterized by a dark brown color. The management for this would include the administration of methotrexate followed by leucovorin, and surgical management would include salpingostomy or salpingotomy. Now for the ruptured tube, signs and symptoms would include the Collins sign or the bluish discoloration of the umbilicus, hard rigid abdomen, and the decreased blood pressure or increased pulse rate. Management for this would be surgical management called salpingectomy or the complete removal of the fallopian tube. I hope you learned something new from this video. Once again, I am your student nurse, Jidal Licudini from the University of La Salle. Always here to remind you that you will learn something new every day if you just listen.